Here's an example of a yearling that's an individual that just standing has every appearance of being a rather correct individual. And without the benefit of walking these yearlings or any other horse as far as that goes, you don't get the full benefit of how these horses track themselves. And when a horse just comes out and stands, if he doesn't have an extremely obvious defect, you may not pick up on it. Plus the fact, always keep in mind that the handlers of these yearlings at the sales are well-trained personnel, and they're trained to stand those individuals in the most appropriate manner to exhibit not only their good side, but also to try to cover up any minute fault, and many of these handlers are able to do that. So it's imperative that these individuals be walked, and I think this is an excellent example. Just standing, as you can see in this view, it appears as though this is a fairly correct individual. This individual has one small foot and one foot a little larger, which might just point out to you as an interesting byline. But I'd like to emphasize one more time how important it is to observe these horses walking away from you, actually more than coming towards you. I was taught a long time ago by Dr. Arthur Davidson, who's the dean of all yearling inspectors and conformation experts, that you can tell so much more about a horse's knees going away from you than you coming to you. And this is an excellent example. If you notice this particular individual going away from us, you can pick up the offsetness of both knees, and in particular the left knee. And not only that, when he walks with both knees out, and you also can pick up the fact that that small foot, which is his left fore, even though he stood fairly correctly on it, is extremely toed in, and not only is he just toed in at the hoof, he has an angular deviation of the knee and also from the ankle all the way down through the pastern and extending on into the foot. But he stands very respectably. So take time to watch these horses walk. Here's a yearling coming to us that has two severely offset knees, particularly the left fore. As you can see, the carpus on this left leg is extremely offset, and by that we mean that instead of the knee being in straight alignment up and down from the shoulder to the hoof, we have this sort of an offset shape to it. Cannon bone then emerges out of the bottom of the knee or the carpus outside the center. Needless to say, when you have an offset knee this way, it puts undue stress on all the individual carpal bones, but it likewise puts undue stress on the medial aspect of the cannon bone and the medial splint bone. I might just use my own hands, and if you'll notice the palm of my hand on a horse that has normal knees and good correct knees, the face of the knee or the carpus will be directly looking at you as you stand in front of that individual and look straight on. And aside from that, the cannon bone will emerge directly out of the bottom of the carpus and not to one side or the other. And above all else, you do not have any rotation of the carpus or the knee itself, therefore throwing the carpal bones out of alignment. Now, this particular filly that we're looking at here is a perfect example of an extremely bad offset knee, and that left knee of hers is just about like my left hand, and as a result you can see that the cannon bone emerges to the lateral side of the carpus, and that knee won't stand training very long, and as a result of that you can anticipate that she'll break down very early on in training. Here's another good example of a yearling with offset knees, and as you can see, the off fore or the right knee in this particular view is extremely offset. And when you have a knee or a carpus that's offset to this extreme, you don't have equal and even loading factors on all the carpal bones as well as the cannon bone as it emerges offset out of the carpus and predisposes to carpal injuries and in particular carpal fractures. I think this would be a good time to point out that we also like to take a plumb line from the point of the shoulder, and that plumb line should start at the shoulder, should bisect the forearm, should bisect the knee, should bisect the cannon, should bisect the pastern, and in turn should bisect the hoof. So when you stand directly in front of that individual, you should be able to draw an imaginary plumb line and have all those structures directly in that line. It's obvious from where this plumb line is that this filly's knee is offset, and likewise in. Now I might say this, that there are certain sires that will reproduce offset knees, and those particular sires, needless to say, have offspring that run much better in European racing than they do in American racing because they're on the turf all the time. And the turf is a very forgiving footing for these horses to be on, and they can live with a lot of conformation defects in Europe that we can't live with on the dirt tracks and the turf tracks in our country. Bad-kneed brood mares, bad-kneed sires reproduce their own kind. Now this horse coming to us right now, when he gets himself together, is an excellent example of a horse that's in at the knees and toes out at the base. Now this sort of a situation, as you see him stand here, first of all, I need to compliment the farm that has this horse because they have some corrective shoeing and trimming on him, which helps to minimize the visual aspect of how much this horse literally does toe out. If we back up here to his knees, and we can see that the angulation of his knee, instead of being straight, if you dropped a plumb line from the point of his shoulder down through his foot, you'd find that his knee is offset to the inside, and that's what's commonly called in at the knees. This horse would have benefited tremendously when he was a foal had he had the periosteal elevation surgery done right here. This is a very saving operation for these young horses to prevent this from happening to them, and it corrects this problem tremendously. Now, as you notice, this horse being in at the knee, then the cannon bone is offset out of the base of the knee, and as a result, it has a tendency to rotate, and as the cannon bone rotates, then his foot points out, so this horse actually toes out down here. And this type of a horse, when he walks, obviously he's going to be close at the knees, and he's going to be close at his ankles, unless he has a very broad chest. And when he does this, he's going to interfere at his ankles when he tries to perform. Now, as I said, the farm here has done a remarkable job of trying to, and they've done a tremendously good job, the farrier has, in putting these shoes on, because they've corrected his foot to correct the toe out. They've lowered the outer wall, left the inner wall longer than the outer wall, and in essence have tried to turn that foot in without warping the foot. And the farrier that they use is an excellent farrier. I take note right here, the height of the nail clinches are all the same all the way around that shoe, and that's a sign of a good farrier.